right now. It's an atypical version of killer kennel cough that we've seen off and on throughout the years. We're going to talk about what's happening. We're going to see symptoms, outcomes, prevention, and what's next. So what does this infection look like? How is it spread? How can you protect your dog? Questions I get continually all throughout the week. Kennel cough is a multifactorial disease characterized by inflammation of the upper airways. That's classic kennel cough. What do we mean by upper airways? Upper airways are essentially the trachea and upper bronchi. Kennel cough in its simplest form is not pneumonia. It is not a serious life-threatening illness. But for the last several months, dogs with kennel cough-like symptoms are coming in with what looks like kennel cough, and all of a sudden they get a severe pneumonia. Some of them have bad outcomes. Not a good thing. We're going to look at this and understand exactly why. This infection is spread rapidly, first identified in the Pacific Northwest in the States, and now it is now well distributed across the country. Dogs at risk are dogs in close proximity. That's why we used to call it simple kennel cough. Boarding kennels, daycare, rescue centers, shelters, dog areas where dogs come together, even outdoors like dog parks, training events, dog shows, dog trials and the like. Even grooming parlors can become a place where contact can occur. Symptoms: a harsh, dry cough that is very loud. It's not it's a that you can hear from across the room. It can wake you up at night. Most patients don't have an appetite loss. Most patients aren't that ill. Some of them, appetite will drop a little bit. Most are not running a fever, and they're not bad, except they're going, and they many times they'll bring up a white foamy type stuff. Most commonly, we'll get initial calls from our clients that say, Fido's got something stuck in his throat, and we'll say, bring him down, we'll check him. What turns out to be symptoms of classic kennel cough. If the symptoms progress, if they're untreated or you have this nasty underlying infection, if the symptoms progress, you can get fever, you can get appetite loss, sometimes ocular nasal discharge. The junk coming up turns from white foamy to maybe yellow phlegm or maybe nothing at all. They can have deep, heavy breathing, abdominal respirations, and start feeling really, really crummy because this is now progressing into lower airway disease and something like pneumonia. And pneumonia is going to be associated with I feel crummy, I'm running a fever, my appetite's going to go down, I'm going to be coughing more and more of a deeper type cough, and I'm not going to be feeling good. Those patients need to see their veterinarian immediately. Get on the phone, get on the internet, whatever it takes to get your kid in and get him treated. Mitigating factors that will reduce their resistance and increase their risk: poor health to start out with, poor vaccination to start out with, stress in the family. Just had a patient that was been doing a lot of traveling, even though in the backseat of the car, didn't like the car, didn't whatsoever, stopped various places with other dogs, and they got sick. Areas that have poor ventilation and high humidity, you put a dog in a car, and if it's breathing and it's a Bernese Mountain Dog, like I have a car and a Bernese Mountain Dog, the humidity goes from 25% to 95% in about an hour. Not good. And the high humidity increases the risk of problems. And what do you have in boarding kennels and daycare? Indoors, a lot of water, sanitation, which is good for sanitation purposes, but the humidity goes up, and their risk factors for transmitting upper respiratory disease goes up and up and up and up. So what's really happening? Well, we have patients that come in with kennel cough or symptoms that look like kennel cough. They look exactly the same as kennel cough, but the outcomes are different. The outcomes are different. Simple, and they're unpredictable. The simple, old-fashioned, classic kennel cough, what I'm calling classic kennel cough, is many times a self-limiting disease of the upper airways. Is loud cough. They don't feel bad. A significant percentage of those patients never make it to the veterinary office because they're just not that sick, and the cough kind of goes away all by itself in 3, 5, 7, 10 days. The outcomes are different. What do I mean by the outcomes are different? Well, in this killer kennel cough situation, we get 3 types of situations: mild, chronic, and poor. The mild outcomes are basically like classic kennel cough. You have mild to moderate upper airway disease, inflammation, coughing. Most of these patients are minimally are sick for a while, but they're minimally responsive to antibiotics, but they can easily be treated as an outpatient. Outcome number 2, many of these patients are going to require hospitalization because this infection goes into pneumonia pretty quickly, and it's a pneumonia that appears to be minimally or not responsive to antibiotics. We've got some better combinations now that we've got a couple months experience under our belt treating this, but this killer kennel cough situation appears not to be responding to classic antibiotic therapy for classic pneumonia. Outcome number 3 is poor, an acute pneumonia that progresses rapidly to a very sick patient, and some of these patients have been reported to have bad outcomes, i.e. death in 24, 36, 48 hours. Not good. So what we know, this infection is spread nationwide, and we're seeing statistics in urgent care and from insurance companies that the diagnosis of pneumonia is up by about 50%. Now that doesn't mean that 50% of the dogs out there have pneumonia and have this illness, but it does mean that in the treatment centers they get the worst of the worst and the baddest of the bad. There are cases on a month-to-month basis, year-to-year. In other words, September, October, November of 2023 compared to 2022 is up 50%. So what it's not, and why can I say that? It's not flu, canine influenza. It's not known bacteria. It's not known viruses. It's not mycoplasma all by themselves. So what we need to understand here is that there is a standard of care test that we use in most of these patients that come in with now upper airway disease, kennel cough-like symptoms that could be harboring something really evil. And you got this list of 10, 11, 12 known, some bacteria, some mycoplasma, some viruses. Don't concentrate on that list. What you need to take away is, remember I said this was multifactorial? What do we mean by that? Well, kennel cough, in my profession, is no longer allowed to be called kennel cough. You have to take an oath that says you're going to call it canine infectious respiratory disease complex. What does that mean? It means that we now have identified over 30 separate organisms, some bacteria, some viruses, some mycoplasma, a whole bunch of separate little things that are known to be involved in creating this cough, pneumonia, disease process. So, in classic kennel cough, you basically have one of these that's causing the problem, you treat it and they get better. What's happening with this mystery infection, this respiratory infection that is killing all these patients, is that you're having multiple infections of these many times, and that the underlying cause is not really one of them. So what really needs to occur is for someone to isolate what the underlying cause is and identify it or not. A lot of people are looking at the university level and the research level. No clear winner is coming out. What it's not are this group of scary things from distemper, the canine coronavirus, canine influenza virus, mycoplasma, and the like. None of those infections are showing up on the standard test, which is a pretty accurate test nowadays. So it's not one of those things, which is bad because many of those, some of those anyway, can have vaccines and the patients can be protected for. So what I'm doing in my office is we're keeping up any known patients outside. We're doing curbside treatment, kind of like back in COVID days when we were afraid that people were going to make us sick. Now we're afraid our patients are going to make other patients sick. So we're keeping everything isolated, curbside triage, curbside treatment, and using standard of care antibiotics and protocols to keep things under control. The patients that I've seen are all falling into this mild case. I have reports from colleagues in other areas around my area of not so mild cases, but so far my cases have been in the mild situation. I like to say that the vast majority of my patients are in the healthy status. They're well protected with the current standard of care of vaccines, and I think that's going to hold true and well for all of us. For what I'm doing personally, social distancing is the name of the game. Not owner to owner social distancing like we had in COVID, but dogs need to stay separate if you can. If you can is the operative word. We've canceled dog shows. The biggest dog show in Southern California, west of the Mississippi, is coming up this weekend, and we're not going to be there because I can't risk getting my dog sick. I have baby puppies at home. I can't risk having them sick, so we're sitting this one out. Training classes and the like. I feel like I'm a lot better off at home and not nose to nose with anybody else. I have clients that are still running agility, but they've got their dogs in the car. They bring them out to run the course, go back in. That's pretty excellent social distancing and using the old noodle upstairs to the best of our capacity. And I think that's a really good strategy to use to the best you can. I realize some of you have to travel. I realize that some of you don't have a sit-in person to come in and you have to board. So be aware that all boarding facilities aren't the same, and make your inquiries. Pick your battles the best you can, but do the best you can to have a very safe and um, I was going to say successful. Don't like that. Do the best you can to have a safe holiday from the top end of the leash to the bottom end of the leash. And that's my message for the day. I want to wish you the blessed holiday season and a safe um, holiday for you at the top of the leash and a safe holiday for Fido at the bottom of the leash. Thanks for joining me here today. I'll take any questions as they come across the screen in just a second. But I want to wish you a very blessed holiday season and a very safe and prosperous new year. Thanks for joining me this last year. I appreciate all your support. And it's me, Dr. B, signing off for 2023. Had a question about cats. Um, Cats appear to be protected or immune or not susceptible to this current mess that's going around. So no reports that I'm aware of from colleagues or emergency centers or anything else. So we're happy with that. The um, there are in classic kennel cough a few of those 30 plus organisms can infect cats. Specifically, Bordetella can infect cats, and if you're boarding your cat, for sure you can get Bordetella vaccines for your kitty, and that's a high level of protection that you should definitely consider for making sure that your kitty has no problems for the rest of the year. If there's no other questions, it's me, Dr. Speed, signing off. Have a great and happy and healthy New Year.